One of the main concerns of women undergoing hormonal replacement therapy is the risk for breast cancer. Even if that risk does exist, I think it has to be put into perspective. And the first perspective we should put it in is what is the overall risk of dying of breast cancer compared to other disease. Actually, when you look at the graph, which is here, you see that for women that are above 45, by far the main cause of death is heart disease. 1 woman out of 4 is going to die of heart disease, and actually less than 3% are going to die of breast cancer. So even if women are usually checked up for breast cancer by mammograms every 2nd year in the Quebec government program, they should have also tests for their general heart condition, either through an stress echocardiogram or some other manner to check actually their general heart health. The other second actually main concern for health would be first lung cancer. So again, women should have lung evaluation every 2nd year because more women are going to die of lung cancer than of breast cancer. And when they're above 75, stroke would be the second most important cause of death. So breast cancer is the third main cause of death, never the first. That being said, let's look at what is the importance of hormone replacement therapy on the burden of breast cancer. About 10 years ago, there was a large study in the US done, which was called Women's Health Initiative. That study wasn't done properly, but still there's some results that we can get out of it to give us a general estimate of what would be the risk of breast cancer. And you have to understand that actually the hormone replacement therapy that women took for that study were not the ideal hormone replacement therapy. They were taking mare's hormones, actually, which was Premarin, and they were taking a progestin, Provera, which is more inducive of breast cancer than naturally occurring progesterone. But even in using that, what I would say bad hormone replacement therapy, let's look at the different risk factor for breast cancer in women. In non-user of hormone replacement therapy and having actually no known risk factor, actually 45 out of 1,000 had breast cancer during the study. If you see women that use hormone replacement therapy in that bad regimen of hormone replacement therapy for 5 years, 2 more women had actually breast cancer at the end of the study. For 10 years, 6, for 15 years, 12. But let's look at the other factors. Women that were drinking more than 2 drinks of alcohol a day had twice more risk of having breast cancer than women that have been using hormone replacement therapy for 15 years. Lack of regular exercise had the same impact, twice more risk than hormone replacement therapy. Late menopause, which is actually having your own hormones, your own cycle for 10 years more than the average woman, actually gives you more risk of breast cancer than taking hormone replacement therapy for 15 years. Actually, if you're overweight, being overweight gives you more risk of developing breast cancer than 15 years of hormone replacement therapy. Weight gain of more than 20 kilos or being obese actually gives you 4 times the risk of having hormone replacement therapy for 15 years. Late childbearing or reduced breastfeeding increase the risk 4 times more than 15 years of hormone replacement therapy. So you see with these data that even the bad regimen of hormone replacement therapy was much less inducive of breast cancer than certain lifestyle factors like lacking of exercise, actually drinking 2 glasses of alcohol a day, or actually having a weight gain which is significant, or even simply being overweight.